A very good afternoon to all the enthusiastic learners. I, Dr. Vasha Sharma, reader, PG and PhD guide in the Department of Organon at Dr. G.D. Paul Foundation, Yerla Homeopathic Medical College, Navi Mumbai, extend a warm welcome to the audience, distinguished speakers of today's webinar, Dr. Sneha Bhosle and Dr. Mandar Patkar, and to our esteemed chairperson of the webinar, Dr. Page ma'am, to the national webinar on homeopathic approach in epidemics. Few days ago, we received an extremely disturbing news regarding the demise of Dr. Praful Vijayakar sir. This has been a very sad moment for the entire homeopathy fraternity and a major loss for homeopathy. Let us all today join together and pray for the departed soul to rest in peace by maintaining 2 minutes silence. Thank you all. Now, proceeding ahead with our webinar, today's webinar shall emphasize on the philosophical aspects involved in the homeopathic management of epidemic diseases. The aim of today's webinar is to comprehend the correlation of the homeopathic principles involved in the management of epidemic, to understand the prophylactic and therapeutic approach in the homeopathic management of epidemics, and to learn to construct acute totality of the disease leading to the successful treatment of acute diseases in a shortest way. Our two highly experienced speakers of the day shall help us to accomplish these aims. Before we start with our session, there's a sincere request to all the learners to kindly mute your speakers. We shall be having a question and answer session at the end of the webinar. Hence, all of you are requested to put in your questions in the chat or the comment box along with the name of the speaker to whom you want to address the question to. So initially, we'll just listen to our speakers. Our first speaker of the day, Dr. Sneha Bhosle, shall be speaking on philosophical perspectives in the homeopathic management of epidemics. Dr. Sneha Bhosle is a professor, PG and PhD guide in the Department of Organon at Dr. G.D. Paul Foundation, YMT Homeopathic Medical College, Navi Mumbai. She has got a vast teaching experience of 20 years. Dr. Bhosle has graduated from CMP Homeopathic Medical College and has been associated with ICR at the ML Dhavle Trust. She is an examiner, paper setter, and moderator at various universities. She believes in regularly updating herself, hence, she is constantly attending various clinical sessions organized by Ayush and Central Council of Research in Homeopathy. She has been trained in teaching learning methods of MUHS through MET and HSET workshops. To her credit, she has authored various articles and has been a speaker at CCRH seminar and National Workshop and Seminar Horizon. She has also coordinated Homeopathic case sessions at Horizon. With this short introduction, I welcome Dr. Bhosle to start with the first session.
Yeah, am I audible, dear viewers? Just give a thumbs up if I'm audible.
Yes.
Yeah, thank
Dr.
you.
Sneha, you can start.
Yeah, thank you. Yeah, very good afternoon to all the viewers, to dear students, teachers, practitioners who are presently in discussion in this webinar. Today I start with philosophical perspectives in the homeopathic management of epidemics. So here, essentially, we are trying to discuss homeopathic management, okay, and philosophical perspectives. In the sense, we will try to go through the history of of epidemics pertaining to homeopathic management, and try to integrate it with the various concepts in homeopathic philosophy. How epidemics and their management has really brought about, in fact, the evolution in homeopathic practice and homeopathic thinking. Essentially, epidemics have been down the era since man is there on earth. However, we will be focusing on those epidemics which are since the discovery of homeopathy, since we are keen on homeopathic management. And therefore, the objectives would be to know the homeopathic management. Okay, so we will be considering the epidemics since the discovery, that is, 1796 was the birth year of homeopathy. So we'll see the epidemics from 1800, 1900, and 2000 till 2020. We'll see the homeopathic principles involved therein by different homeopathic practitioners, physicians, including Hahnemann. Further, we will try to correlate and see where all Hahnemann has used this data that he got through the experience of management of epidemics, to the literature of epidemics, how he has incorporated all that to understand and to build up the philosophical thinking in homeopathic practice. So, as directly hitting on the management part, we have a triad approach in homeopathy, and that includes management of a homeopathic of a epidemic with nosode, okay, with the genus epidemicus, okay, or with the constitutional remedy. The latter two being called as homeoprophylaxis, whereas when you do with a nosode, it is called isoprophylaxis. Now, this, like when you do with a nosode, you are giving a lot of importance to the agent aspect. Okay, when you work with the genus epidemicus, as a nozo, as a the homeopathic specific remedy, you are giving importance to the environment or the mass susceptibility which was deranged, which is leading to the specific remedy. When you work with constitutional approach, you are giving importance to the host factors. So via this triad approach, actually we are indirectly working on the agent host environment model of disease. Now there have been, since the ages, okay, almost from before Christ era to after Christ, there have been so many epidemics. They were known in Egypt, the three great plagues of Egypt, okay, and that is linked to the supernatural concept of disease. However, we will, as I said, we will be focusing on the epidemics from since the discovery of homeopathy. So around, homeopathy had been just discovered, as we discussed, from 1796, okay, birth year. Around that time was the epidemic of smallpox in Europe. Again, in this discussion, I would just like to again emphasize that when we use the word epidemics, that is synonymous with pandemics, that is synonymous with calamities or outbreaks, and synonymous with sporadic or endemic, because all these apparently different terms, okay, mean mass diseases, or it means mass susceptibility deranged. So when we talk of mass, essentially the approach is quite similar. So I'll be using these words in synonymous in this presentation. And further also to just to check on you that what we discuss through these epidemics, essentially I'm trying to just focus on the highlights in terms of the when it occurred, the disease, okay. However, there is a gentle request to all the viewers to, if they have to check the details, can go to the respective epidemic references and check the details. The slides here are presented with a view to focus only on the homeopathic management. And those many essential details about the epidemics are therefore mentioned. So now see, like when I here mentioned, 1799 was a smallpox, but there have been epidemics many before, okay, and smallpox. But in 1799, when a homeopathic management was evolved, we'll be discussing around that. So essentially, when I say 1799 means that time was when the homeopathic management took place. So in Europe, Dr. Bonnie has mentioned he managed the epidemic from 1796 to almost 1800, that is 1799 to 1800. And then he wrote a paper considering the curative effects of thuja, wherein he saw that in the last 6 months, these are the actual words from the lesser writings of Bonnie, where he mentions that smallpox has appeared. The thuja was prescribed in the very first case, and it has, he says, that exceeded all my expectations when the pustules fell off, dried up by fourth day and fell off by eighth day, okay, leaving no pock marks. And he had prescribed 200, okay, though Hahnemann had worked till 30th, Bonning and some philosophers went higher in potencies. Now, in this very epidemic, okay, which was around 1796, 1800, when even Hahnemann had just discovered another new principle of practice on Sibylla, while this epidemic was going on, there were some sporadic cases, okay, of measles, okay, wherein it was seen that there were individuals in the epidemic who presented both smallpox and measles, giving a very complex clinical picture. And Handyman has noted these observations and concluded a dissimilar disease phenomena, type 3. Then we have, just to notify, where homeopathy was again played a significant role, was another epidemic of smallpox in 1900 in USA, where 2000, almost 3000 people were affected, were given variolinum. Okay, now this is the basis of Dr. Clark's nosodes. The variolum prepared from the smallpox vesicle was given. 574 exposed to the disease, only 14 developed. Okay, so it worked almost 98% effective as a prophylactic drug. Now, as almost homeopathically the epidemic was getting managed till 1800, was another epidemic which broke out around 1801. That is the scarlet fever. Around Kuonischlutter, which was the sojourn of Hahnemann, there was an epidemic, okay, of scarlet fever where children were getting that was the most prominent target population which was getting affected. In 1801, Hahnemann closely observed the scarlet fever patterns, okay, and he observed the symptoms. On the basis of symptoms, he concluded on the drug belladonna. Besides, there were other drugs also like opium, camphor, depending on the presentation, okay, where there was a lot of drowsiness, delirium, camphor, where there was a sudden collapse, ipecac, where there was with the with the symptoms of throat pains, there were nausea symptoms, and where there are suppressed cases of scarlet fever from allopathic management or old school, having even prescribed camomilla. But the prominent drug was belladonna. 1808, there was another wave of scarlet fever when aconite proved to be a specific remedy. Hahnemann called all these acute diseases, okay, the epidemics, he called them as fixed miasms or fixed diseases. And the remedies that came up, he called them as specific remedies. Further, having managed 1801 and 1808 epidemic, Hahnemann noted down his observations in the observations on scarlet fever, a paper that he wrote. Another epidemic similar in 1820, which was there, okay, where only 7.5%, okay, of the children were given belladonna. They remain only 7.5% remain unprotected. So almost 93% were protected. Okay, these are some other years mentioned of the scarlet fever where homeopathy played a major role. Now, With this management of scarlet fever, again Hahnemann has made a note. Okay, when this epidemic was there of scarlet fever, called as popularly known as scarlet in of Sydenham, because Sydenham had identified the disease, it was Hahnemann observed that while people or the children suffered, okay, when they got, again there were some endemic cases of cowpox then, where cowpox suspended scarlet fever, and again the children suffered with scarlet fever. So he has made an observation on dissimilar diseases or dissimilar pathologies or different pathologies, how they behave in the human body under the type 2 type of dissimilar diseases. Besides this, Hahnemann very, very keenly observed and differentiated it with a purple, erythematous, dark purple erythematous rash, okay, which was a closely simulating disease called the purpura miliaris. And while the old school physicians were so confused, and they were giving prescribing even belladonna for purpura, because Hahnemann was giving a very good prophylactic result, so they were even prescribing. And then they said that belladonna doesn't work, but Hahnemann very properly differentiated that this is not at all scarlet fever, so belladonna will not work. His concept of specific diseases and specific remedies and fixed diseases or fixed miasms. So he says it will work if it is only scarlet fever. So that way, this shows only how Harriman on clinical, okay, or bedside was very closely differentiating diseases. Okay, and he was not very superficially working on symptoms, but symptoms meant much more to Hahnemann. Further, we see with the scarlet fever experience, Hahnemann also had given very detailed instructions on how to prepare the medicines. Okay, and this is about routes of administration. He gave clear instructions how it has to be given when it was in the very newborn or neonates. Opium, camphor could be given through nasal. It was more effective by nasal than by oral route. Hahnemann further talked of when belladonna is prescribed, he gave certain instructions on diet and regimen. Okay, and suppressed cases we saw. Okay, how he prescribed chamomilla. Besides, in the scarlet fever epidemic, also Hahnemann, for the first time, he devised a scale. Okay, the centesimal scale came into advent with the scarlet fever, because Hahnemann started standardizing the dilutions. Okay, so scarlet fever actually initiated the centesimal scale, which Hahnemann gets the credit to devise. So as the scarlet fever epidemic had quiescent, okay, in 1803 again there was this typhus epidemic, okay, in 1803, which was when Napoleon was marching towards Germany and to attack Russia, he withdrew, and that is when Hahnemann typhus epidemic was going on, okay, and that is when Hahnemann treated, and he was able to treat 180 cases very successfully. And typhus is again a rickettsial bacterial disease. Okay, it's also called as hospital fever. And Hahnemann treated quite successfully 180 cases, specifically with bryonia and Rustox in alternation. So here again a concept of alternating symptoms. Okay, very very clinically applicable concept of when the totality matches prescribed, when the totality changes, alternate the remedy. Okay, is what Hahnemann has mentioned in his lesser writings on typhus. And this epidemic during this time, the conventional treatment had a mortality rate of over 130, whereas whatever little Hahnemann treated, 180 cases, he was 100% successful in this disease. It's a So then we have around 1816 to 26, there was the first wave of one of the most devastating epidemics, okay, of the globe. That is, it's almost a pandemic. It was, that is cholera, which started actually from the It started from India, Bengal, and then it rose to China and then spread in Europe. Okay, the second wave in 1829 to 51 was it when it affected even Europe and US. And during the second wave is the homeopathic intervention scene, when around 1831-32, Dr. Bonninghausen, okay, has given very clear-cut instructions on cholera management. You know his book on prevention of cholera, okay, prevention and its treatment of Asiatic cholera. Now, Bonnie-Gosson treated, okay, and prevented a numerous cholera patients to a mortality rate of 15 to 16. Okay, whereas the death rate with conventional treatment was this. Where for cholera, they the treatment mode of treatment was, because of the diarrhea, because of hypovolemia, there is increased viscosity. So do bloodlettings. Okay, this was the management, very very harsh management. Okay, wherein homeopathy was use very gentle management modes, that is, namely the remedies, okay, the dilutions. Camphor was prescribed by Bonninghausen. Hahnemann added to that cuprum and veratrum, depending on the symptoms. The convulsions, cuprum, veratrum, if there was a diarrhea, okay, and if there was collapse, it was camphor. Now, besides the just a mere potency management or a drug management, Bonninghausen gives clear instructions in the management of cholera on regards prevention, then during the disease with the remedies, and post, that is convalescence. So in prevention, simple things, but Bonninghausen found that there was a lot of fear and panic, okay, the fear of death, okay, with the fulminant diarrhea. So he has given that if you reduce this, much of the disease doesn't occur. Then he gave further to avoid excesses, okay, because it is a water or foodborne disease, okay, contamination occurs, and therefore the Vibrio cholera spreads. Further, extremes of temperature, okay, heat and cold, okay, in the environment or in consumption to be avoided. Now, these apparently are very simple instructions, okay, but they were managed, and good prophylaxis were achieved by mere controlling the fear and anxiety. Now, also, in COVID, the mental health is so much of a concern in epidemics. So similar. So Bonnicausen had given an instruction, and he was quite successful with these simple instruction modes. Further, in convalescence, also Bonnicausen has identified that there were three patterns of presentations: a hypersensitivity state, okay, in the form of neuralgias, pains, and aches post the diarrhea. There were hyposensitivity, okay, or in the form of muscle fatigue and soreness, myalgias, and there was other presentation of delirium, torpidity, and absolute insanity. These were the convalescent patterns that Bonninghausen identified. So you see that Bonninghausen and Hahnemann, okay, how they are approaching the disease in a totalistic extent, how they are going way beyond, okay, the mere superficial understanding to go into detailed management. Further, we have, while I said the second wave in Europe was being handled by Hahnemann, by Bonninghausen like pioneers, while in US and in Austria, that is Bonninghausen's motherland. Okay, so we have these remedies. Mainly Bonninghausen focused on camphor, whereas Hahnemann also suggested cuprum and veratrum. And mortality rate was in hospitals 7 to 10 only, whereas with conventional treatment it was 40 to 80%. Okay, so these are some of the statistics then prepared and made. Further, in US, where the second wave had already spread, there we have the Ehrman family. It was a very famous family of homeopaths. The Ehrmans, they treated about 1100 cases, okay, with only 9%, that is 50 deaths. Whereas there was 60% mortality in US, okay, with conventional treatment. So Dr. Pulte and Dr. Ehrman, with their success in management of cholera, almost established homeopathy in US, okay, with the success in cholera epidemic. Similarly, Hahnemann in 1801 and to 1810, when he managed, he was able to successfully introduce homeopathy in Europe. Okay, and in fact, during Hahnemann's time also there were oppositions like Hufeland, there were Sulzer, Dr. Mueller. Okay, but seeing the prophylaxis that belladonna gave in scarlet fever, okay, they accepted homeopathy as a system of medicine. At least they have accepted the prophylactic role of belladonna very clearly, and thereby Hahnemann was able to introduce homeopathy. Okay, and Suno, in 1810 he wrote Organon. Similarly, in 1831-32, with the successful management by Pulte and Ehrman, okay, they were able to establish homeopathy in US. So thus we have some statistics here of certain diseases where you clearly see a very distinctively drastic differences, and absolutely success with homeopathic in terms of results. Okay, now again a lot is stress on prophylaxis, okay, is proving more successful. Around 1879, yet another devastating pandemic, the yellow fever, which consumed okay, almost two-thirds of Europe. Okay, that was the devastating presentation of this disease. Yellow fever, again it is a viral fever, okay, and it presents mainly with, as the name suggests, fever and jaundice. Okay, further it has fatal effects because of toxemia and septicemia, because of viremia. It affects it immediately runs into a progresses to renal failure, heart failure, and liver failure. But because of essentially the septicemia and toxemia, it is very critical a disease where there is hemorrhages, okay, and coagulopathies. And during that time, just Herring had discovered and proved crotalis, okay, and it proved to be one of the successful treatments for yellow fever in 1850-60. Herring managed the yellow fever in US around 1862. Okay, there was this endemic pattern, okay, and an epidemic, okay, some pockets, and they make some pockets epidemic in New York, okay, where Bradford managed with the individualized homeopathic remedy, whereas Dr. Clark in 1920, when there was a second wave of diphtheria, managed with a nosodiphtherinum. Individualized means, I suppose you all know, it is along with building up totality of symptoms and managing. Diphtheria, about it, Kent writes that this disease is generally looked up with terror. Okay, the physician's death list will be small if he observes all the symptoms of the patient, and a mistake made in the first remedy is always death. Okay, that critical was diphtheria. Okay, apparently upper respiratory tract, but it proved to be it is a highly toxic disease. The first prescription, when chosen, will cause the membranes to fail. Okay, so if there is a mistake, so the Kent is very clear. If there is a right remedy, the Kent is also very clear with the remedy response. Okay, again, a very important note for all of us. Kent says, okay, that there are plenty of symptoms always with the patient presence, most of the patients present, but prognosis only will be favorable, not plenty of patients with the patient number of symptoms, but if there is a doctor also who understands how to read the symptoms. Okay, so this is a very very important clinically significant line that he has mentioned under management of diphtheria in his lesser writings. Besides, in diphtheria and lesser writings, Ken talks of how totality can be built up with some of the pathological symptoms. Okay, that to name a few: exudative inflammations, the throat, nose, larynx affections. Okay, the zymotic states, the characteristic discharges. Okay, he talks of again where you can also build up a totality with individualizing symptoms. Like symptoms, he has talked of picking of nose, and he has given a small repertory of diphtheria in his lesser writings, from the odor of the mouth, lips, from type of pain, sensation that the patient says, you can get a individualized remedy also. So around after diphtheria was a wave in 1900. Now 1800s we are through. We are into the 1900s. That is the 20th century, where in 1906-7 there was epidemic of typhoid, where again lesser writings, Kent in US, management of typhoid cases in US, uh, Kent concluded that I don't have much time to talk about the generals, which Bonington had done in cholera management. He, but Kent directly hits on the homeopathic aspect. That is, he says that physician, when he enters a room, he should immediately start observing and gaze any and everything in the patient's room for symptoms. Further, he says that under typhoid, he has again given a mini repertory of typhoid in his lesser writings on symptoms when there is on the basis of type of fever, intermittent, remittent, what are the drugs he has listed. I have not listed the drugs in my presentation, but you can always refer. He has given that you can build up a totality time modalities, and he has given mentioned the drugs according to his experience, which was he was able to give results. Restlessness and anxiety that he managed in typhoid, and the drugs which he has given, he has mentioned. So you can build up a totality with this, with muscle twitchings, weakness, mouth sores, nasal odors. So these are the symptoms on which totality can be built up in typhoid, is what Kent is indicating. Further, one of the most again there were four, in fact, very devastating epidemics. Okay, they were almost the pandemics. Like you have the plague, the yellow fever, cholera, okay, and now the Spanish flu, 1918. And this is one of the epidemics where a very systematic data recording has been done under homeopathic uh, uh, by the homeopathic school and homeopathic physicians. So we see here Spanish flu, in fact, affected from 1918 to 1920. It is the H1N1 group of viruses. Okay, uh, and it affected this, and there were 3 to 5 waves, of which there were three most significant successive waves which devastated Europe. So here you have the start date was this, and almost 500 million cases, of which 17 to 100 million deaths. Okay, whereas when whatever the number of patients treated were not many, we will see the next slide, but with the homeopathic management there was one third less. Okay, which was the mortality was one third less. Similarly, parallel groups which were treated with conventional treatment, okay, there was a very high mortality rate that was observed. And Spanish flu, which is also called as the Great White Plague, because two-thirds of the Europe was swiped off again. Okay, it was genus epidemicus, was gelsemium, then arsenic, were the other remedies which got indicated in the management. Dr. Pearson in US, Philadelphia, he collected about 26,000 cases from various homeopaths. Okay, and it was identified there was only 1% mortality, whereas with the average conventional school or the allopathy, it was 30%. 30 physicians in, whereas in Europe, that is Derby in Connecticut, okay, where Roberts was practicing, he also collected the data, okay, of almost 6,000, over almost 6,000, 6,500 cases, where 55 only deaths, that is less than 1%. And in fact, this was the time when the First World War had just ended, 1914 to 1918, and this epidemic just broke out. And Dr. Roberts, he was on one of the warships, and he was managing the soldiers. In his ship, nobody got the flu, whereas in other ship, only 31 soldiers were lost with homeopathic treatment. Okay, and Roberts managed his warship soldiers very well. Around again the same time, the same period, there were about Dr. Frank Wieland. He noticed about 80,000 workers in one of the industrial plants with only one death under the management of Gelsemium. Okay, so the Spanish flu, and this was the largest data we have of homeopathic management being successfully done. With the Spanish flu epidemic, okay, we have in 1916 to almost 58, there were 4 waves of polio. Okay, where we have Dr. Arthur Hill Gilmer. He was a student of Kent. He treated about 500 cases, okay, children with homeopathy, and none developed polio. Second wave, which was in Argentina, okay, and he also treated with Lathyrus. Second wave, which was also treated with Lathyrus. 1950, the third wave in Johannesburg, okay, in South Africa, treated by Taylor Smith, okay, with the same, with 100% results. And 1957 also the same. So this is one of the epidemics where all the 4 waves were treated with the same drug. So it's one of the very prominent and important drug in treatment of the spinal viremia, Lathyrus. So thus we, in almost the till here we have the specific remedy, that is homeopathic remedies basis on the basis of indication, that is the symptom totality indications being indicated. From little later than early 1900s, okay, when Clark practiced in England, okay, and he prepared nosodes in the various epidemics from 1900 onwards, 1920 onwards, we see nosodes being prescribed. To name a few are these: tuberculinum, anthracinum, oscillococcinum, meningococcinum, variolinum, diphtherium, morbillium from measles, and leptospirinum. There are some other nosodes. So 1900s, we see epidemics being managed with nosodes, that is as a genus epidemicus. So there were these 3 waves of plague. You know, plague is a Yersinia pestis. It's one of the rickettsial bone diseases, bacterium, which is transmitted through the rodents, okay, and a flea transmitted, which rests on the rodents. And you know, it has a direct effect, okay, it affects the brings about nephrolysis and a renal failure. So there were these 3 waves: 1865, 1904, okay, and around this wave, okay, which affected Australia. Also there were some presentations in Europe, in England, where Clark practices, and he prescribed plaginum with good results. Now about plague, not these epidemics, but there were plague, which was the most devastating, that is one of the very severe epidemics, okay, pandemics in 1300s. much earlier. Okay, like cholera, yellow fever. This plague of 1347 was one of the most devastating, okay, epidemics, pandemics rather. And in the medical literature written of the 13th century, there is a mention that in the plague, okay, which was one of the most fatal epidemics, okay, people who were suffering from scurvy remained protected. This observation mentioned in the medical literature, Hahnemann has noted down and mentioned in the 36th aphorism, the type 1 of dissimilar diseases. Okay, but so far as the plague, which again returned in 1865, we have this, and in 1900 to 25, we see Clark's approach of nosodes being successfully applied. In 1974 to 1998, there was a meningitis epidemic in Brazil, where again meningococcinum, it was managed with a nosor, where in 1947 and 1998 there were two waves. In the first one, almost 19,000 individuals voluntarily took in Brazil the preventive dose. 95% remained protected in 6 months. It was a 2-year trial done. Okay, so 74 to almost 75. And in 1998, okay, another wave where more than 65,000 children between the age groups up to 20, okay, took the dose, and 95% remained protected, and 92 in the first 6 months, and 92% in the next 12 months. So this was a 2-year observatory trial done, management of epidemic done in Brazil with meningococcinum. In 1987 was the whooping cough. Okay, Clark had managed this disease. Okay, the sporadic cases or the in England with pertussin, but later when it broke down, okay, broke out in later when it broke out very majorly in 1987, what Clark had prescribed, okay, earlier or in his sporadic cases was useful, the pertussin 30 nosor. Okay, and another wave was there when again uh, whooping cough was a significant epidemic, occurred in 2010 to 14. But in 1987, in United States, when it occurred, okay, pertussin was prescribed. Okay, and Kent had, Clark was much earlier to that when he had prepared the nosol. But later, this also in the epidemic it proved useful. And you see in 212 also further when it broke out in US, okay, there were almost 48,000 cases which were uh, of whooping cough which were seen. So it is one of the recurrent epidemics. Similarly, we have in 1989 to 2002, and then another recurrence wave in 2014. This is an Indian study of Japanese encephalitis, again a viral bone disease. Okay, directly, as you know the word, it directly affects the brain, and it was founded in Japan. So Japanese encephalitis, an Indian study in Uttar Pradesh done by one of the most senior teachers, okay, and pioneers, Indian pioneers, Dr. Rastogi sir. Under his supervision was this trial done in Uttar Pradesh in all the 3 years, 1989, 91, and 93, wherein belladonna in single dose was distributed as preventive to more than 3 lakh, one of the very large trials in homeopathy in 96 villages, okay, and in 3 districts in Uttar Pradesh. And a follow-up was done, okay, of wherein almost 40,000 persons, none of them was affected with the symptom. Further, later in Andhra Pradesh, when this broke out, there was this BCT, that is Belladonna, Calcarea, and Tuberculinum regimen adopted. Okay, and the mortality dropped from 1,500 to only 400 in the next year when a second another wave came. Now, BCT, as you know, it is based on symptom similarity, complementary relationship, and miasms. Tuberculinum, anti-miasmatic prescription, and you know that calcarea and belladonna have a complementary relationship, acute of it, and the chronic remedy is calcarea. So, on this remedy relationship, okay, and symptom similarity and anti-miasmatic basis, the BCT trial underwent in the management of Japanese encephalitis. Further, we have in 1996, 2001 to 12, and 2016, dengue, which affected. Okay, again we have an Indian trial here. Besides, dengue also was prominent in these 12 years in Brazil, when eupatorium it was getting managed with homeopathy, where 40% residents, okay, remained uh, residents of the most highly affected uh, dengue zone, okay, remain protected, okay, and where dengue incidence was there, it decreased by almost 81%. This is in Brazil. The Indian study in 1996, 2012, and 2016 saw various drugs, prominent being eupatorium of them, prescribed. Okay, also nozo, denguinum 30 was prescribed. Okay, in the 1996 Delhi studies, almost 40,000 people, okay, who were affected. Okay, and a follow-up was done 10 days later, wherein only 5 people had developed mild symptoms. So almost all the 24,000 were protected, okay, with dengue, that is in Delhi. Other remedies which are also when the it broke out, okay, 2012. If you see the CCRS site, these all epidemics are named as calamities. Okay, so these were epidemics, these were endemic outbreaks. Okay, so the approach is the same. So we have considered here. So phosphorus, crotalis, these are other drugs also getting indicated in Kerala. Okay, management was with Naxomica 30. Again, like 1996, 2016, again Delhi there was a outbreak of dengue. When again you see eupatorium. Earlier it was a nozo, now it was a eupatorium which was being prescribed. It prevented 85% of the population, okay, from getting the disease, okay, as compared to the no intervention cohort. So now we enter into the 2000s, okay, except for one again I'll consider measles study, but now we just see the prominent epidemics so far as homeopathic point of view, management point of view in the 2000 era. It begins with the SARS, that is the severe acute respiratory syndrome. You know, it is one of the corona group of viruses, the present ongoing pandemic group of viruses. And Dr. Vitulkas, okay, Boric Allen, okay, in their mention of flu-like disease management and therapeutics, Dr. Schroens in his synthesis repertoire, okay, has given indications of drugs like aconite, arsenic, eupatorium, gelsimum in early stages when there is viremia with myalgias, body ache, joint pains, arthralgias. When a bronchopneumonia sets in, okay, uh, Pithulkas and others have indicated remedies like phosphorus bionium. And in the final stages of respiratory failures, drugs like antimtar, baptisia, camphor officinalis are being indicated. And these esteemed practitioners have indicated 200 or 1M as the most indicated potency in the management of the SARS pneumonia. In 2006, 7, and later 16, you have chikungunya, another viral disease, okay, a mosquito transmitted viral disease, wherein again there were 3 waves: 2006, 2007, and 2016, where you see eupatorium again being one of the prominent drugs. In 2006, 3 doses were given, okay, daily for 5 days, okay, and the result was prevention, okay, of almost 83%. 2007, when there was a bryonia being prescribed in the both 30 and 200 as per the indications, okay, there was a reduction of almost 20% risk in the medicinal group as compared to the in the double blind placebo controlled trial. The post chikungunya chronic arthritis management studies also were conducted. Means after these epidemics, okay, a long-term management of arthralgias which continue to persist after the epidemic, they were being again managed with the same drug, eupatorium, and these arthralgias got prevented in 85% of the population. Further, we have in 2007 to 10, there were many epidemics in Cuba, like Brazil. If you see geographically, Brazil is one of the countries where there were so many epidemics, I mean, in terms of the region which got affected with epidemics globally. Similarly, Cuba in North America is another such region which got affected. And there were so many epidemics in Cuba, very prominent. Of them were leptospirosis, hepatitis, dengue, swine flu, pneumonias. The most prominent epidemic, okay, series was of leptospirosis, where the remedy was a nosode being prescribed, genus epidemicus, a nosode prepared from the four strains of Leptospira. Okay, and they are prescribed with 200 potency in the first year of epidemic, and later in the second year, 10 potency was prescribed, and the observation was quite promising. Leptospira surveillance statistics revealed 84% decrease in the incidence rate, okay, when they were treated with the nosode, in spite of there being three hurricanes in Cuba. In contrast, those which were incidents of leptospirosis in others untreated provinces, they rose by almost 22%. Okay, so there was a very successful with the nosode prepared from leptospira. Now, this is about the 200, but we are just discussing till here. We discussed, we saw mainly nosodes being prescribed from 1920s to almost 2010. Okay, so this was a group of epidemics or the list of epidemics where nosode was prescribed. We now just see one epidemic of 1981, 1991, the measles. Why it is significant? Because a lot of uh, uh, about this epidemic is discussed in Dissimilar Diseases by Hahnemann in Organon, wherein he talks, okay, of measles suspending when there was an epidemic in his era, Hahnemann's time, how it suspended cowpox. There was an epidemic of cowpox in Europe, and in the epidemic, there were few sporadic cases of measles, which when the children suffered, cowpox did not express the fever. Okay, and then when measles ran its course, cowpox again expressed. So measles, if you see, has been discussed when discussing dissimilar disease type 2, dissimilar disease type 3. Okay, measles also is discussed in type 3, where he discusses existence of measles and smallpox together, forming a very complex picture. So from that point of view, it's relevant. And in measles, again, you have one more nosode prepared morbillinum, but I have not mentioned any studies done with morbillinum. In fact, Indian study of management of measles in 1985 to 1998. That's why I didn't mention with the previous list. So now I'm just taking this where no nosode management is there. So we've taken it separately. So where in UP, Andhra Pradesh, Madhya Pradesh, and Rajasthan, arsenic 30, pulsatilla, and kalimur and ipecac, on the basis of indications, proved to be the remedies which manage the epidemic of measles. In 1912, now this is Indian study. Besides the global observations are in 1912, measles had become a nationally notifiable disease in United States, and there were almost 6,000 deaths reported each year. And in 1963, a vaccine became available. Children got the vaccine, okay, and it much controlled, okay. But there's something called as post-vaccine illness, okay, where people in fact also died, okay. 400 to 500 people died, okay. So out of encephalitis, okay, in spite of vaccination drive continuing. This is just the global scene, okay, and this is the homeopathic management so far as the Indian scene is concerned. Further, we have continue with the 200,000 epidemic, that is the swine flu, that is the H1N1 group. This is the same as the Spanish flu, that is 1918, which occurred. The same group of viruses, and this H1N1, the HN group viruses, there were these various outbreaks: 1957, H2N2, in British Canada flu epidemic, 68, H3N2 Asian flu, which was the avian flu epidemic. Okay, these are most of the zoonotic spread diseases, viral diseases. 1977, you have the Russian flu epidemic, and in the one of the most severe epidemics in 2009 and 15, mainly 9 when it was very severe, the swine flu pandemic, wherein Rustox, okay, there is Bryonia alba and there is Eupatorium, which proved to be quite successful in controlling homeopathic way, in the homeopathic management. In 2012 to 15, there is this Middle East respiratory syndrome, that is the camel flu, also known as, spread via the camels, zoonotic viral disease similar to the corona group, and first reported in Saudi Arabia in 2012. Later, in June 15, okay, the spread got notified in 20 countries, and MERS virus, of course, the disease affected only 2,500, but it killed almost 1,000 patients. Again, here, Eupatorium, Thuja trials, so far as homeopathic management is concerned, proved to be useful. Belladonna proved to be one of the important drugs in the management of symptoms. So in 2014-16, there is this Ebola virus again. Okay, it's also known as the Ebola virus disease or the Ebola hemorrhagic disease. Okay, it broke out in South Africa, that is Southeastern Guinea in Africa, and then later spread in Europe. Okay, in 2014, however, now this is an important statement in contrast to present legalities what are going on in COVID. In 2014, WHO clearly stated that it is ethical to offer unproven intervention, okay, with yet unknown efficacy and adverse effects as potential treatment or prevention. This was one of the statements made, okay, which uh, which has been flipped by WHO presently, not allowing, and even the Ayush Ministry has kept Ayush medicines under prophylaxis and not to talk about treatment. But who had said this, made this statement in Ebola virus? And in West Africa, when it affected, that is in Guinea, that is when the snake group of remedies proved to be quite useful. Again, Ebola, like yellow fever virus, also has a lot of septicemic, toxemic state which presents as a DIC, okay, intravascular disseminated intravascular uh, because of coagulopathy. So, because of the coagulopathy, the snake remedies have been indicated, and you see Crotalus, okay, uh, more prominent and more successfully used than Bothrops and Legacies. In 2016 was the malarial epidemic, and we have again the Indian study here, where malaria officinalis or nosor being prescribed. Okay, we have a study of Shadol in Madhya Pradesh. 23 villages reported incidents, okay, where more than at least two persons were affected. But with the prescription of malaria officinalis, okay, in a graduated way, almost 28 villages, okay, of which who were under surveillance, only 7 villages reported malaria with less than two, which was 23 more than two. Now only 7 with less than, those also with less than two number reported. Okay, so it had very much brought down the incidence of malaria in Madhya Pradesh, malaria officinalis. Further, now we take a brief look of epidemics from 2017 to 2020. Globally, if you see the scene, you have the outbreak of hepatitis in 2017. In August 17, again, outbreak of plague, okay, in Madagascar, okay, in Middle East, Africa. And then you have a typhoid outbreak, okay, in Mexico, cholera, okay, in Yemen, Africa, and then you have the avian influenza in China. This is between 2017 and 2020. These are some of the epidemics. Further, from homeopathic point of view, in terms of understanding, practice, okay, tuberculosis outbreak and HIV proved to be significant. So I've just made a mention where tuberculosis, though it was identified in early 18th century, 1720, Dr. Martin had identified it as a disease, though the organism was not isolated, and he had prescribed a sanatorium cure, which in by 1884, 1882, Dr. Roberts Cox identified and isolated the bacterium and developed a specific antibiotic, and you have the list. Okay, so in 18th century, under Dr. Martin, sanatorium management, okay, there were as high as 900 deaths per 1 lakh people who were affected. Okay, whereas in 1882, after isolation of the bacterium, still TB killed 1 out of 7 people in United States and Europe. And in HIV outbreak, you know, it started in 1981 in Africa and presented as Pneumocystis carne pneumonia and Kaposi sarcoma. And yet today, as of WHO recognizes HIV as a global epidemic, a continuing one. In 2018, you have approximately 40 million people infected, and more than 7.5 lakh deaths from AIDS in 2018. So these are significant outbreaks in terms of understanding disease and in terms of understanding health and where is humanity and progress in terms of health. global health progress. Further, just to make a mention, these are the list of epidemics, the Indian scene and the Indian management. You can always refer the CCRS site for the same. In 2010 and 12, the flu-like illnesses which occurred and they were pan-India managed. Okay, the prominent drug which came was arsenic 30, and this experience and empirism has been applied in the present COVID uh, pandemic, where the Ayush Ministry has talked, the CCRH has talked about arsenic 30 to be prescribed as genus epidemicus. It was on the basis of this experience. Okay, and these are some of the epidemics. These are some of the names of the, I have just mentioned the genus epidemicus which were there. Besides this, in the respective epidemics there are other drugs also indicated. You can just refer the CCR site for the same. We discussed that epidemics, pandemics or sporadics, they are so far as synonymous so far as homeopathic management is concerned. So there are some, we just saw epidemic, the epidemic of Ebola. Then there was an endemic also, a pattern which came up in South Africa besides the epidemic. Again, the same drugs got indicated in the management. Another endemic of dengue in India, okay, where these drugs, aconite, belladonna, bryonia, rustox, eupatorium, jalsemium got indicated. There were certain sporadic cases, okay, of childhood diarrhea, where prominent drugs like arsenic, podio, chamomilla, and chikungunya Indian trials, double-blind, placebo-controlled trials with bryonia and eupatorium showed quite promising results. So coming down to the present COVID-19, you know that the atypical pneumonia which broke out, which China declared in December 19, which became an international concern by January 20 and declared as a pandemic in March 20. And the earliest studies by Dr. Wang Tu in the outskirts of China in Hong Kong suggested bryonia as one of the important drugs in the management of COVID. Also, he suggested with the symptom totality basis, jalsemium as a drug. Okay, so thus symptomatology becomes one of the important tools, okay, in homeopathic management of diseases, epidemic diseases in specific that we are discussing today. Just because, and the approach is what? It's a mass disease, it's a mass susceptibility. Okay, a set of few symptoms form the totality. The set gets repeatedly confirmed. Okay, that enhances the confidence. Okay, in the totality. Further, certain drugs, and therefore you can prescribe the drugs, the materia medica becomes clearer. These are the advantages of managing homeopathically an epidemic. Further, if you manage the epidemic and there are certain symptoms which are not covered in the totality but get cured, only become a clinical source of materia medica. So we have, where all Hahnemann has thus mentioned epidemics and evolved the concepts is in 33 aphorism. Okay, he talks of disease as an unconditional, rather drug as an unconditional force and a superior to disease. Wherein in the scarlet fever epidemic, Hahnemann's observations where certain children, okay, I mean, he mainly worked by prescribing belladonna on prophylactic basis more than curative. After his very strong observation of few children, specifically a girl in a family where all had affected with scarlet fever, and only that girl who was taking atropa or belladonna for some other illness, she remained protected, and the entire family died of scarlet fever. This was a very striking observation, and Hahnemann took this observation and prescribed on this basis preventive, and he was successful in almost 100% cases. So, with this epidemic, he describes drug as a stronger and a superior force. He has used this observation further to conclude this statement. In the various discussions on dissimilar disease, we saw how different epidemic combination, an epidemic and a sporadic combination, an epidemic and endemic combination Hahnemann does, and he has explained about how if the phenomena are different, okay, if the agencies are different, how they interact, and they never settle each other. Whereas if the phenomena or pathological processes, okay, or processes in general, if they identify with each other partially, okay, or totally, they are able to cure. Wherein he's talked of how when the smallpox epidemic broke, how these symptoms got much controlled, chronic symptoms of the patients. Further, in disease classification, he has again classified in 73 as mentioned epidemic diseases. And there he mentions of the two types, that is once in lifetime and which recur frequently. This has a lot of clinical significance, okay, the recurring and the non-recurring concept that Hahnemann has given. And once in lifetime, he mentions as smallpox, measles. To the individual patient, it is once in lifetime. So whooping cough, okay, the scarlet fever, and the recurring he mentions as the plague, yellow fever, Asiatic cholera. Further, he mentions epidemic. He gives very definitive guidelines on how to approach epidemic case taking and towards the case taking aphorisms in 103 footnote. Hahnemann talks about epidemics. If they are acute character, fine, but if an epidemic recurs, okay, in an individual patient, then the SORA, latent SORA, must be investigated and a constitutional remedy has to be prescribed. So this he has talked in detail when epidemics prove to be under chronic diseases, intermittent fevers, 241, 242 aphorisms. That is this 41, 42 epidemic diseases or single epidemic, okay, and when they are weakened with appropriate rather inappropriate allopathic treatment, okay, you need to have a constitutional or an anti-soric approach and not only the presenting totality. These are so clinically significant instructions that Hahnemann gives via epidemics on a general homeopathic practice basis. Footnote to aphorism 81, where in the disease classification he talks of epidemic diseases, okay, and he talks of how the epidemic diseases we already discussed. He talks that they are what, they are just particular names, okay, they are specific episodes, okay, and there the most the approach will be the most striking symptoms, okay, and he says that no two epidemics, even if the nosologically they may be same, they are the same epidemics. Okay, and this is also agreed by the famous physician Sidney, who named the scarlet fever. He also insists that on what, the necessity to take to consider an epidemic as never having occurred before. Okay, that every epidemic has to be treated separately as an individual and a new episode of a clinical phenomena. Thus, we see the contribution of epidemics in development of the miasmatic theory or the theory of chronic disease. Okay, Hahnemann mentions in his book on chronic diseases their peculiar nature and homeopathic cure, SORA, okay, which occurred, and he has talked of how the epidemics of the malignant erysipelas, okay, in the Middle Ages, that is the 5th to 12th century, later which transformed into leprosy in the 13th century, which later got transformed, okay, by 15th century into the simple itch. Okay, further he has talked of the, the outbreak of syphilis, okay, in 1493, how it led to a continuous suffering, okay, in the name of different diseases, okay, Hahnemann has noted from the medical literature. Another he has noted from the medical literature is the figwort. During the French war, there was an outbreak of gonorrhea in 1809 during the lifetime of epidemic of Hahnemann, wherein he saw that the high inappropriate management of mercury, okay, led to numerous continuing ongoing patterns after the gonorrhea epidemic. Further, uh, in the discussion of these epidemics, observation of these epidemics, mainly the scabies, erysipelas, and the leprosy, Hahnemann says in context to these epidemics, Hahnemann says that these epidemics further led to numerous troubles, painful ailments, spasms, ulcerations. This all he has mentioned in his footnote 281, okay, which crippled the soul and the mind. So he has mentioned the whole range of diseases which these three epidemics led to, right from simple inflammatory to metabolic endocrine, where he talks of sterility and gout, to insanity, okay, and ongoing irreversible pathologies like cancers. Also, he has attributed to SORA to an extent as during the onset. Further, the same what Hahnemann wrote in his chronic diseases in a simple way, Roberts has mentioned in his book on Sora miasm in his chapter, wherein he talks how Sora developed from this transformation of this epidemic from a plague, it transformed itself into leprosy and scabies, how these diseases have been responsible for ongoing numerous nosological diseases. And Stuart Close has used this same concept to discuss the latency pattern of any disease pathogenesis. Further, Stuart Close has mentioned various numerous epidemics, trying under the sub-chapter in pathology of homeopathy. This chapter there is a subtopic, bacteriology and homeopathy. So by calling specific diseases, okay, Stuart Close hints that Hahnemann was hinting at microorganismic cause of disease, and he was already hinting at the viruses, bacteria, or the parasites. Further, in his one more subtopic of SORA and tuberculosis, Stuart Close has been able to link, which Hahnemann had already done earlier, that he said that if ever among the miasms there could be a combined is the combination of SORA and syphilis, that is tuberculosis. And also later, from bacteriology point of view, we know that leprosy is Mycobacterium tuberculosis and tuberculosis is, is Mycobacterium, and this is Mycobacterium leprae. So both are from the Mycobacterium genus. So they bacteriologically also they are linked, which via the miasmatic theory Hahnemann and Audley linked them. So thus we see further going ahead in our thinking of uh, uh, philosophy and concepts. I already discussed that in we discussed that in the paper on cure and prevention, how Hahnemann gave the detailed instructions on the route of administration and all. And that time also we mentioned that he devised the centesimal scale of belladonna and chamomilla, where he prescribed in third and the fourth dilution. And now, by this, Hahnemann got clear with the management of epidemics that the dilution does not have only the purpose of reducing the aggravation, but diminution of action was not proportionate to the diminution of the quantity. In fact, he says diminution or dilution, okay, got or resulted into release of a great healing power. So it never meant decrease in action; it meant multifold increase in healing power. Further, now as we have run through the various epidemics and the outbreaks from 1800 to almost 2020, we see that most of them are viral, okay, where they present as viremias and culminate into pneumonias. So when there was this epidemic, okay, of pneumonia in 1951-57, okay, in England, Dr. Douglas Borland has managed the epidemic, and he has concluded how he managed in his book Pneumonias, wherein he gives very, very clear cut instructions on how to manage, and he has identified 5 stages of pneumonia. Simultaneously, he has given a mini repertory and discuss how to directly manage. Besides, he has given some important concepts of management of potency, okay, and how high potency is frequently repeated, low potencies and their repetition would lead to lysis and crisis respectively. So these important philosophical concepts are mentioned when Borland managed pneumonias. Besides this, Dr. Burnett has talked in 1884, which Hahnemann had already talked in his theory of chronic miasms. Hahnemann had mentioned about vaccination as one of the concerns, or uh, one of the causes, or he has in fact included under fundamental causes one of the types, vaccination. But the topic was further taken more ahead in a more systematic way by Dr. Burnett in 1884, where he gave the term vaccinosis, and he has written a book on that. In that, he mentions certain important points where he found that vaccination induces illnesses, chronic illnesses have Thuja has a very good scope, okay, on the basis of homeopathy. Further, he has stressed on law of similars also to be applied. So we come to now with clinical and homeopathic practice. We talk about the practice essentially should culminate into research and further improvisation of practice itself, which means, so Wang Tu, which I just showed you the symptomatology, he has given this research paper where the data can be documented of the present COVID epidemic, pandemic. So he has talked of this. Similarly, each one of us practitioners can, or teachers or institutes can have their own protocol where we can data record our management of the present ongoing. This is the the pro forma of the of Dr. Wang to regard the present COVID-19. Now, having done with research, I would further like to emphasize that in spite of seeing a lot of scope, seeing a lot of efficacy of homeopathy, still we should remain within the legalities and understand our limitations so far as the social and political scene is concerned. So, in the present COVID pandemic, in January, March, and later again, re-emphasizing December 20, the guidelines of Ayush, which says that all those under Ayush, all the systems of management okay, should use their intervention as on the prophylactic basis, okay, use simple remedies based on presentations, okay, they can claim them to be preventive measure but cannot claim to be cure. So thus, what do these epidemics take us ahead? What challenges they have is that so far as the modern medicine is concerned, in spite of advancement, okay, in the medical science in terms of availability of antibiotics, antivirals, a huge advancement in laboratory investigations, various preparedness measures, yet the healthcare system faces a lot of challenges with COVID spread over 213 countries, where over 17 lakh cases and almost more than a lakh deaths. Still, it is devoid of salutary therapeutic intervention. So far as challenges in homeopathy is concerned, is yet we are to prove our objectivity. So in that context, there are certain trials which are done in vitro, showing the mode of action of the drugs and the objectivity towards homeopathic modus operandi, where influenzinum shows a clear metabolic and morphological alteration, which in the host cells. There are some in vivo studies, that is nothing but the clinical evidences and evidence-based medicine, clinical control trials, various cohort studies. Yet, the fundamental research, okay, supporting immunoprophylaxis is yet to be explored in the branch of homeopathy. Similarly, the nosodes which are being used, the present COVID also has a COVID-19 nosode prepared by a group of homeopaths. So these nosodes which are being prepared, okay, they are introduced or they are being dispensed without appropriate human provings, which is the standard classical approach, and also they lack sufficient standardization, thereby inviting controversy. So these are few challenges in vitro, in vivo that we face. So with this, I would like to conclude my presentation, wherein with these references made, okay. And to end with, I would like to say a simple prayer of Om Sahana Bhavatu, which means it's a prayer between the disciple and the teacher. It's a prayer between the seeker and the knower. So I pray and wish that each one of us, whatever roles we are playing in homeopathic practice, whether as as a student, as a teacher, or as a practitioner, let us all work together, okay, for a better tomorrow in homeopathy. Thank you so much. Yeah. Thank you for a patient listening too. Thank you.
Thank you, Dr. Bhosle. Thanks for the elaborate explanation and for taking us through the journey of homeopathic management of epidemics, right from Dr. Hahnemann's times to the present COVID times. As Dr. Bhosle has made us transverse to the COVID times, I'm sure we all are having several questions arising in our mind regarding the homeopathic approach in COVID 19. To highlight certain aspects on the same, we've got our next distinguished speaker, Dr. Mandar Patkar, who shall demonstrate the guidelines utilized in the construction of acute totality through few cases. It's a matter of great pride to introduce Dr. Mandar Patkar, an alumni of our institute. He has been practicing classical homeopathy since last 20 years. He is attached to the Other Song International Homeopathic Academy and to the Indian Homeopathic Medical Association. So, is the founder of a study group called Harmony with Homeopathy. Dr. Patkar has been appointed by Maharashtra University of Health Sciences as a mentor for special courses in homeopathy. He actively conducts seminars at IIHP Mumbai and for postgraduate students at Bharati Vidyapeeth Pune. Presently, Sir is working on deep pathological cases and their management with homeopathy. Sir's topic for today's session is understanding totality of symptoms in the homeopathic management of COVID-19. Requesting Dr. Patkar sir to kindly start with his session.
Hello, hello. Can you hear me
Yes,
all?
sir. Yes, sir. You're
Yeah,
audible.
okay. Thank you so much for giving me the opportunity. First of all, I thank GD Pole Foundation for giving me such opportunity to speak in front of our students regarding this uh, epidemic crisis. I also thank our principal, uh, Dr. Pramodini Page Madam, for giving me this opportunity to speak in front of our college students. And all the students who are listening to me, thank you so much for being here. And because this topic, what we are going to speak now, is a hot topic, what we can say in this current pandemic. And with respect to homeopathy, uh, we have seen in the first session, which is wonderfully explained by Dr. Sneha Bhosle madam, that she has given the history of epidemics and whole scenario what is going on in present situation. As far as clinical practice is concerned, what we are doing in our regular clinics and regular clinical practice. And the first thing I would like to tell you one thing, that I was appointed by Bruhan Mumbai Mahanagar Palika to monitor the cases at the center, which we called as NESCO center, where the uh, temporary hospital is formed by Bruhan Mumbai Mahanagar Palika. So I was there to monitor the patients. I have seen almost around more than 1,000 cases of COVID. And on that basis of COVID cases, in my clinic, we have treated few cases successfully. Though Dr. Bhosle has told that we are on the second line of treatment, not claiming that we are curing the cases, but that everybody knows with the holistic approach, what we are doing now, the whatever may be the pathology, whatever may be the changes in the lungs, we can reverse it with our homeopathic practice, homeopathic remedies, and proper selection of the remedy. The first thing I would like to say, while seeing the case, in this case, when people come to us with the COVID symptoms, or what we have done to in this pandemic, that we have not seen the COVID patient directly in front of us because of the safety of other patients in the clinic and even our safety. But we have taken a video call and even a phone call, and on that way, uh, we are going to we have prescribed on that level. But fortunately, with the acute prescription, acute totality, which is taken on proper basis, Hahnemannian indications, all the patients who took homeopathic medicines, they are doing well. They have the pathology has reversed, and they are very happy with the homeopathic treatment. The correct, as I have told you, the correct prescribing, what we have said, is based on basically the acute observation of the patient, while acute case taking in such cases is very important, because the faulty observation, if you do, that give rise to miserable failure. And in acute case taking, we don't have any time to see the whole family history, whole life situation, and then we have to prescribe. There is no time for that. The patient is having fever, 102, 103, 104, with acute symptoms, then we have to prescribe in that situation quick prescription and bullseye prescription, which is practically we have to see. When people say homeopathy is slow, we have to see that, we have to show them that this is not a slow practice. Immediately patient feels better within 48 hours. We have seen the cases where patient, even with the COVID situation, with fever cases, are getting all right in 48 to 72 hours. And I have seen the changes in the lungs also getting all right within 4 to 5 days. So while taking the case, first thing what we have to do, just a minute, I'll show you the presentation. Yes. So the understanding of totality of symptoms in COVID-19. Why I've written specifically COVID-19? Because this type of prescription is always been will take in any kind of epidemics, not only in COVID, but now what we are all going through this difficult situation of COVID, and people are afraid of going out, afraid of uh, even touching others, meeting others everywhere. So we are concerned with this. So I'm specifically written as understanding the totality in COVID-19. So as we see, according to Master Hahnemann, what is acute disease? That acute disease is has an exciting cause. What we see, it comes suddenly, and the course of disease is very rapid, and it ends either in death or recovery. So if we speak about the state of disposition, the acute disease is the state of person which remains for the limited period of time. Usually it's been called as fever, pneumonia, bronchitis, hepatitis, gastritis, endocarditis, and so on. What we are giving the name to that particular state, but it actually just the pathological tissue changes what we see in the person or what we see in that man. And these are the changes, the acute disease, and these are the result of the disease and not the cause of the disease. The acute disease and the cause remains behind it, and that is to be identified first, and that is to be removed. So the what we see, the pneumonia, what we see, breathlessness, it's not the cause, it's the result what we see because of the deviated vital force. It is seen that in the acute disease is caused by an acute exciting factor, such as any physical factor, what we see, any psychological factor, any biological factor, or any chemical factor. These what these factors. Now we have to analyze the intensity of this factor by examining its effects on every other person in the same area. The causative factor can be the factor of epidemic proportion also, what we are seeing in this COVID-19 crisis. So the COVID-19 has affected the world in all the possible way. That is physically, COVID-19 is affecting people. That is, they are getting sick. Psychologically, people are getting affected. Financially, they are getting affected, and socially, they are getting affected. If you see, when the lockdown started in March, after that, I have seen there is number of cases which related to psychology or psychiatry, the depression cases, the even with the anxiety neurosis cases, even the sadness, nervousness in people have increased. The insecurity has increased. This is all affected people psychologically. First, in the first few days of lockdown, people have taken it very positively that this pandemic will go in some 1 or 2 months. But as the day passed, they came to know that this pandemic is not going to go easily, and that is the reason the changes started coming in the mind. The fear factor, unfortunately, our media, which has created the fear factor in people, that has affected people's psychology to a lot of extent. And because of that, first, as we know, the immunity of a person goes down with the fear, as we all know that. So the fear factor has taken over the people, and the immunity went down. And even after taking a lot of precautions, everybody was taking every precaution, whatever they are possible in doing, but still the number of cases went on increasing, and the fear factor remained. And this is all because of the psychological effect of the COVID-19 crisis on people's mind. Secondly, we see physically. Physically, we are going to see in a cases where we will come to know. Financially, also people are affected a lot, and the economy of uh, this thing has gone down.
Your
Everybody is hello.
country
Everybody everybody got affected financially also, socially also. The social gatherings and people, they whatever they were used to meet, even they are afraid of talking to each other, they are afraid of shaking hands with each other. That closeness of people have gone down or gone back. Even the way of looking to each other change. They started looking each other suspiciously. Even if a person sneezes or coughs in company, even then also people started looking at that person very suspiciously. So much so as the fear factor what we have seen in this acute state of fear. So definitely all these things we have to see in the totality. When the patient comes with the fever, in this almost all people are afraid of having covid. When the patient gets fever, the first thing comes in that person's mind is, yes, I have got covid. And what happens if the covid is positive? What will be the future circumstances if my test comes positive? This is all these people, this is a common state we are seeing in clinic since last 8 to 10 months, where people are in this acute fear state. So when all these people are in this fear state definitely is a part and parcel of the genus epidemicus of the COVID-19 for the COVID-19 remedy. So these people, we have to consider this fear factor, but only thing is that just do not consider the fear. We have to see the reaction and adaptation of that person in that fear. For example, that as we see compensated or uh, out of proportion reaction, what we say, if a person is reacting to the situation in a very vague manner, then that considers to be a out of proportion reaction. For example, if a person is chased by uh, any you can say lion, then the reaction of obvious reaction is the person starts running from that lion or tiger. This is what the obvious reaction, which is a compensated state. But if a small puppy is behind him and he's running like he is followed as if of lion, then that becomes the uncompensated acute state. So this, how the person adapts to the situation, that has got very much important in acute totality case. So this acute totality has to be considered while taking the generalities of the person. What is generalities? What is generalities of a person means the general condition of a person, where when the person is uh, not at ease or in a disease state. So how the generals of a person gets affected first, because we always consider as general is the totality which is most important, which is given by, even Hahnemann has given higher marks to the general symptoms than the particulars. Of course, if any particular symptom is very characteristic, then that also can be taken as a total in a totality of a symptom. So the first thing in acute totality case taking in fever management, where we see the cases of fever in COVID, the first thing we have to see the activity of a person, where the person is active, where the person is dull, where the person is sleepy, where the person is having some another is in a delirious state or whatever. The thing first, when the person enters in the clinic, the first thing we have to notice is the activity of a person, that we have to observe. Dr. Boger says that if we do faulty observation, then we fail miserably. And that is why we have to see the exact unprejudiced observation. What is the activity of a person? Why activity of a person is very important? Because if we see in materia medica, if we read materia medica, there are the remedies which we known with, the remedies are known for their pace, where remedies are known for their pathological changes, where the remedies are known for their activity. For example, if we see coffea, uh, and if we see tarantula, these are the two remedies of, or even if we see murk, even if we see certain tuberculinum or calcarea phos or phosphorus, these are the remedies what we see are considered to be very vivacious in activity and very quick in activity. So if the person is very dull, when the person enters in your clinic, if the activity is very dull, obviously immediately we can rule out all those remedies which are very active, which are very vivacious in the disease stage also. So immediately our choice of remedy lessen down from more active remedies to less active remedies. Vice versa, if the person is very uh, you know uh, very dull, very active in the clinic, then we cannot think uh, the remedies like Baraita. We cannot think the remedies like calcarea, or we cannot think the remedies like hilaborus, which are remedies to be considered of very dull activity and slowness. Even carbo-wage we cannot consider if the person is very active, because carbo-wage does not have this tendency, or the carbo-wage disposition is not like that. So immediately we come to know the less number of remedies only on the basis of activity. For another example, I can give it to you that if the person comes to you for diarrhea in fever, if a person is having fever and the person has the symptoms of acute diarrhea, and he says that I have diarrhea since 1 day or 2 days, and I have passed motions more than 15 to 20 times, very loose stools and watery, everything, if he tells with the energy level, immediately you can rule out those remedies which are in collapse, right? Those remedy get collapse immediately after diarrhea or losing the vital fluids or losing the water. We cannot consider these remedies, because if the person is very active even after 50 to 20 diarrheas, then all these, even the symptoms are matching, the state of a person does not match to the state of the remedy, and which is on the general level. If we go on just repertorizing the symptoms on the basis of symptoms, then symptoms are vague and they cannot give the totality if the generalities are not matching. So the general activity of a person, if the person is very active, then you cannot think of arsenic alb or veratrem alb or China ars, or antimony tart or carbo wage for all these, or hellebore. You cannot think of these remedies, because these remedies in general it is never ever presented in such situation. The activity is absolutely dull in in acute stages. So the arsenic patient, though mentally restless, though mentally very is thinking a lot, irritable, but the physical presentation of a person is very dull. Though the patient is very dull, his mind is very active, his mind is very anxious. So the verbally you can come to know the anxiety in arsenic patient, and not on the level of physical aspect, because physically the arsenic is so much collapsed state that he cannot even stand after such, and so much so the weakness comes. That is therefore Dr. Fatak or even Kent gives weakness of a person which is out of proportion, out of prostration, out of proportion. This is what usually we see in the case of arsenic. Even the case of China ars, which is a very good remedy, what I have prescribed, I have seen in COVID cases, China ars, even antim ars, antimonum tart, all these remedy which are very dull, which cannot be prescribed if the patient is active. So got it? So this is very important aspect of the generalities of activity of a patient, which we have to see the first thing when the patient enters in your clinic. The way of sitting, the restless sitting or the dull sitting, the whether the person or child, if the child is there, whether the child is playful, whether the child is very dull, whether the child is accompanying, if the child is accompanying somebody, then what about the behavior of the child with that person, that that counts a lot. you know that is very important aspect of the observation aspect. While when we treat the cases, we have seen one patient, I'll tell you one example of this way, that uh, when one child came in the clinic, where he was having fever, high fever, that say around 103, 104 around fever was there, and the child was laughing, and child was playing, and child was having no dullness. But he was accompanied, the father and mother was there with the child. The child was sitting in mother's lap, and he was very playful with mother, but he was not at all playful with father. And even the brother was also there, small brother, and he was also there, but the child was not playful with the brother also. And this shows there was something wrong with the child with respect to father and brother. So I asked mother what happened before fever. So she said that brother has taken his toy and he is not giving to him, and father, instead of scolding the brother, he has scolded the young boy, and that has created state of anger inside to that child. So this is very important. So this is the way we have to see the cause of the fever, why person is getting fever in the acute state also. We have to see the state which comes acutely, because if we don't take that state, we lose a very important symptom, and we take only physical particular symptom and we prescribe, and the patient does not get all right, saying that homeopathy does not work in acute case like COVID. But no, if we see the acute totality in which the elements from, which is many a times which we can't see directly in the patient, we have to observe, we have to read in between the lines, and then only we come to know the exact totality of a symptom. The second thing, we, as I have told you, the behavioral pattern of a person, the behavioral pattern of a patient when the patient enters in the acute state. the, we have to see the facial changes. Some people, they, the agony of pain which can be seen in their eyes, the agony, the painful situation that we can see on the face expression changes while talking about it. Even if the patient is very restless, that restlessness, if the patient is very angry, that anger which are seen on the facial lines are changed. We have to see that. When I have seen one case of a child where the child was having acute fever, and I told him to lie down on the examination table. Child said, and I asked something about the symptoms to that child. The child was 9 to 10 year old. I asked that child, "What happened to you?" And that person was just laughing and not at all giving importance to whatever I am asking. And that person is just ignoring me. So this is very important observation. As far as when you see the patient in the acute state, this is the uncompensated state. Without knowing him, we catch. And that ignorance is the key entry to the person. With the other physical aspect, the child was hot, child was thirsty, child was very much active, child was very talkative, and the lachesis 200 was given to that child, which made him feel absolutely all right in 24 hours. So this is what I'm giving the example of the behavioral pattern, what we see in the observation of the patient. That is what the first thing we have to see. The activity, the patient is active, dull, the patient is restless, physically or mentally, whether the patient is playful or dull, whether the patient, if the child is there, the child is sitting in mother's lap, child is moving here and there, child is touching everything, child is jumping here and there, that everything we have to observe in acute state. Second, the behavioral changes. Then we have to see locally also. If there are certain examples what which are given in materia medica, in a remedies like chamomilla, that one part is red, another part is pale, one part is hot, another part is cold, that all things when we touch the patient, when we check the patient, we come to know. This is also very, very important notification towards the remedy, which we see in the acute totality. I have seen a patient of fever having uh, tremendous craving for plums, where there is no plum were available in the market, but this patient was continuously asking for plums. So this is very peculiar thing which the person and mother said, this fellow never asked for plums otherwise. So, so this is very characteristic change in the adaptation from the nature what the person is taking in the acute state, and that we have to observe. So in acute totality, please keep in mind that this aspect is very important. Then then once you know the acute state, then we come to know about the causation of the problem area. We have to inquire about the causation of the problem area, where now as far as these COVID cases are concerned, the whatever we have observed, in the current slide, the affected people have affected physically, psychologically, financially, socially. So anything from this can be the causative factor for the patients to become not at ease, that is a disease state in acute condition. So these causative factors in acute fever is very important aspect. Sometimes in the patient not giving the acute totality but starts talking about something else only. And see, what I have observed in my clinic, when the patient comes to you for the remedy, whatever things are most bothering and most important for the patient starts talking that. So never ever interrupt the person while talking about the acute condition, because whatever is on the most superficial and the most upper level, where what is bothering the person, which is continuously there in the acute aspect of the person, patient start talking to that. Patient may talk anything about the dream, patient can talk anything about the current situation of life, patient can anything talk about the just of the physical symptoms, whatever things are bothering, these people talk that first. For example, one person came to me with fever. The first sentence person was talking to me was, "Doctor, I have to be all right because I have to conduct my meeting tomorrow. My business meeting is that I have to conduct." So this was business of bryonia. What is everybody knows about it? Nothing new in that. So this is to be taken of business of bryonia, and we have to write it down on the paper that this patient looks like bryonia, just match all the aspect with other physical generals and particulars, because only on the mind I never prescribe, because that is the half kind of prescription I feel. Because what I feel is, when the person's vital force is deranged, maybe it's a dynamic level it is deranging, but where the changes we can see ultimately on the tissues, ultimately on the body, ultimately on the muscles, ultimately on everything in what we see at the tissue level. So the tissues are also the changes in the tissues are also very important as far as the changes in the man is concerned, because man is not only made up of mind, but the presentation of mind is going as well in body also. Every cell thinks, every cell has its own thinking. That is why the mind, obviously the mental state, has definite affection on the person's body, because what we say, mind is the most important physical general. If mind is the most important general, not physical, it's the most important general symptom what we see, and which is governing the whole body. So the mind symptom is going, if showing some things, and if the physical is showing some different picture, then be aware. And only on the basis of mind symptoms which is showing something else, and all the pathological changes and the trait, and as I have told you, the activity and the dullness part and the state is showing some different state, then be aware. Don't only go with mind symptoms and don't prescribe. This will lead to failures, and the patient will get, the partially indicated medicine, and the disease state will recur. So keep in mind that don't prescribe only on one aspect. If if Kent, who we consider as the master of mind of the in the repertory aspect, if he also believes in that, then he would not have wasted his whole life in writing the physical generals and physical particulars in Kent repertory. He would have left the work after using mind section of repertory, and he said, "Yes, mind is a key to man. That's it. Everything is over. Now we have to take only mind and prescribe." Don't do that. In acute totality, it is always dangerous to do in certain things. Yes, I do agree that in certain cases only the mind symptoms are presented by the patient, then go with mind, no issues, no worries. You can go with mind and you can prescribe, because there are all the patients don't talk everything what we consider in our mind that he will talk in a particular way. If we keep in mind that I have to take only the mind symptoms, or I have to take only the physical symptoms, then we started our we are already prejudiced with the patient that I have to ignore physical. Then we are ignoring the very important aspect of the vital force, which is present in every cell, and it is a manifestation of vital force we are ignoring, and that is why we can give faulty observation and we can fail in that. So keep in mind, always keep all those symptoms together. Mind and body correlate. There is always a common thread between mind and body, and those people who cannot correlate mind and body, they prescribe only on one aspect. I absolutely believe in that, because Master Hahnemann, Master Boger, Master Kent has already told that we have to take all those things together, find the common thread in between and prescribe. Those who are doing only one aspect, they are not giving justice to homeopathic practice. So keep in mind, all the totality is very important in acute conditions, even in chronic, not in acute. This is a general rule for homeopathic practice. So the cause has to be find it out. What is the cause? Can be psychological, cause can be any physical injury, cause can be the even the emotional cause, what has affected, or cause can be even eating something like indigestion or something like that. So that thing is to be taken care of. So what is acute state? How we have to see the acute state? This pandemic has affected large area of world and has affected the large number of people. To get adapted to the present situation, every person's protective mechanisms start functioning in a very, very individualistic way. And the manner in which they adapt to that situation is the change of disposition that we have to pick up. Mind well, every person, if 100 people are having the same symptom of fever, every person how they are adapting to it is what is called as the change in the state of their disposition. This acute change in the state of disposition is presented in the form of altered signs and symptoms of the patient. This altered state of signs and symptom is to be treated in that patient. Got it? So the acute state we are going, where we have to treat the state which is existing in the present situation. If the state is out of proportion, then we have to treat that state. But if it's in proportion, then we have to just wait and observe. If that is what we need to see, whether the patient's his own is improving, taking adaptation to the situation, or the patient really requires remedy. Sometimes even after getting cold, cough and fever, the patient's activity, patient's generalities and everything is fine. Then what I do, I just give placebo and wait, because if I see the patient's own vital force is capable of handling the things, only because of the patient is not feeling a bit is not feeling well, because of people's anxiety, and that the patient comes and take, oh, I'm not well, I need medicine. But if the vital force is working on it and the generalities and everything is going well, then I will just observe the patient where the patient is. I'll just give the placebo, wait for the day. If the symptoms are always better, then no need to give any kind of remedy. So that is the reaction is proportionate and in the form with respect to the disease state. Sometimes the acute state don't comes up with the intensity, as the strength of the disease is less powerful than the resistance power. That time, just observe the case and wait and watch. Don't prescribe hastily in every case. Don't prescribe hastily, because sometimes it can be just the indisposition. One day I have asked my there was a discussion in my clinic with some students. I presented one acute case of indigestion, that the patient was having fullness of abdomen, heaviness in the chest, lot of gases after eating, and a lot of uneasiness after eating. So this was the acute condition after eating. So I asked my student, which remedy you will prescribe. Everybody immediately opened the repertory and they started searching gas and everything. And somebody said carbovate, somebody said lycopodium, somebody said calcarea carb, all gas remedies. Somebody said it was just antim crude to be given. Somebody said sulfur is to be given. Somebody said nux vomica is to be given. Somebody said, uh, you know, uh, any remedy which is affecting the digestion power is to be given, antimony crude to be given. But then I said that just observe the person. I have given ajwain in a warm water and the patient was all right in 5 minutes. So this was just the indisposition which we usually take hing or ova, and the patient is okay. So never prescribe hastily. Never prescribe hastily in every case. Just see whether the patient needs the remedy or not. If the patient does not require remedy, that is why Hahnemann has clearly given in his organon about the indisposition. So that we have to study. Organon is to why we study organon, because it has to be practiced in day-to-day life. It has if organon knowledge is not there, we can't practice homeopathy. So this is very important aspect what Hahnemann has given. So be well, see the observe the case and then only prescribe. Don't prescribe hastily. See, perceiving the patient is what everybody of us knows is the individualization. What is individualization? We have to see how the person has adapted to the situation in an individual manner. So observation, as we have already discussed about this aspect about the observation of the person when the person comes in the clinic. I will give one funny example of observation in the clinic. One lady used to come to my clinic for some medicines for about some acute pain in the abdomen, and she was after the remedy was her daughter told me that she is absolutely doing well after whatever we have given the remedy, and she was doing well. But what happens, in my clinic I can see a part of my waiting area from the window, and the part of my waiting area is visible to me. So one fine day I was seeing that lady was standing in the waiting area, and I was there in my cabin, and I could see that lady was chit chatting, and I could see that lady was laughing with other people and talking something good things, making some jokes and all. But I could see that that lady was happy and doing good. After few minutes after few minutes of waiting, her turn came. The way the time she entered in the clinic, she started moaning with pain. So I was surprised that in a few minutes back, this lady was absolutely fine in the clinic waiting room, and once entering in the clinic, she started complaining of pain, and started bending double. She started crying that I'm having pain. So this was the very important observation regarding the patient with respect to the prescription. So, so mind well, these are all funny. We look it's funny way, but it's very important observation of the patient, and we have to catch this without noticing the patient. The patient should not come to know that we are observing, because when if we are observing in a obvious manner, person goes in a compensation state. We have to see the uncompensated mechanism of the body. Then person's brain immediately come to know that somebody is observing me, then they try to compensate the situation. So this observation plays very important role as far as prescription is concerned. Observe how patient presents himself to the physician, see the body language, posture, way of communication. Some people start communicating in a very arrogant way. Some people start communicating in a very dominating way. All these things, their vital force is communicating. Actually, the vital force which is very dominating things, in which with respect to vital force patient present with. Some people are very polite, some people are very arrogant, some people are very abrupt, some people are very harsh, some people are very abusing, some people are very insulting, some people just neglects you, some people uh, even the doctor is sitting in front of you, and you are not giving importance to what doctor is saying. That kind of thing people do. Some people, they come in the clinic and they start conversing on phone, mobile phone, without asking doctor. They talk for minutes and minutes and minutes, and they don't regret on it. All these observations that we have to keep in mind. If you have given appointment to the person of, say, 5 o'clock appointment, then if the person come is, that also gives very important aspect to the patient. If the person is there in the clinic at 4:45, you will come to know the punctuality of the person. If the person comes at 5:15, 5:20, then also you'll come to know the things. Okay, this we have to inquire why you are late. If the genuine reason is there, then it's fine. But if the attitude of the patient is different, then we have to write it down about that attitude. This is all comes in observation. Next comes the tone of the patient while talking to us. Some people speak in a very polite manner. Some people speak in a very descriptive manner. Some people, speak in a very abrupt way. Some people will, you know, in a very loving way. Some people are praising you. Some people are tries to flatter you. Some people are trying to insult you. Some people, they are indulge in their own self. They are busy with self. The tone of the person shows the inner aspect of the person. So all these things we have to see, whether patient is begging, whether patient is crying for help, whether patient is really requiring the help. That everything is observed with the tone of a patient. See that everybody knows, if his mother is scolding us, then the tone of mother's tone is a bit harsh and bit dominating. But if the mother is loving us, then the tone is very soft. With that tone, we can come to know if the person is talking in a sarcastic manner, or person is talking in a real manner, or person is praising you, or person is doing, there is what you can say, the kind of false behavior, uh, kind of a kind of hypocrisy in the talking. And this is what we have to observe in the case. Observe the face, which is the main indicator of one's emotions, and the feeling of observation like sadness, sulky mood, absorbed, irritation, frowning, fear, and anxiety that we have to observe while when taking the acute totality. Now we have to look for the gestures of a person which is repetitively seen in the patient. If any one gesture is repetitively seen in the patient, then that gesture is very important as far as the acute totality is concerned, like automatic gestures, movements of hands and leg. If the person is moving hands, if the person is moving the leg, if a person is talking to wall, anything can be seen while judging the patient. That we have to any specific observation, like is any specific habit or any specific tics what we usually see in people or doing or in children, or even some awkward gestures, some childish behavior, laughing in more without any cause, that we have been crying without any cause. All these things we have to observe. Even the energy level of the patient, the restlessness, what we see in the patient, the way of standing, the way of sitting, even the way of sitting gives important aspect about the patient. If the patient is sitting with just like that, if the patient is leaning forward, if the patient is sitting at the side, if the patient is leaning backward, if the patient is keeping hands like this, everything tells about the personality of the patient. And that we have to write it down, because these things are in acute or in chronic case taking are very important as far as the remedy is concerned. So feel the tone of the patient while he's speaking, as we have told, that seen the hurriedness, the hasty tone, the confusion of mind that we have to observe, the reverence, the veneration, the mildness, commanding behavior, commanding tone, anxious tone, all these things that we have to observe while taking the case. Now, listen. Listen to the patient very carefully. This is what Hahnemann says. Is we have to carefully observe and then listen to the patient, what exactly patient narrates about the disease, and remain mentally present with the patient, that what exactly patient wants to tell you. Each and every word patient indicates, that shows the inner state of disposition. Any peculiar word patient is saying again and again, then write down that word in your notebook, saying that we have to inquire about this word, because this word patient says again and again. That we have to also listen. Very important thing, this is a very important thing, that while listening to the patient, listen it like a common man and not like a doctor. The, then only we can judge the say of the patient very carefully, because if we keep our mind as a doctor's mind in it, then we become prejudiced. Just go with the flow of the patient. Let the patient talk about the state. The patient talk about his own feelings. Write it down. Let the patient talk about his own symptoms. Write it down. And then once you have notified all the symptoms, then what Organon says, once the physician has completed the writing down, then the analysis start. After case taking, the analysis start. During case taking, analysis does not start. During case taking, we have to keep our mind as a screen of a cinema hall, like a white screen. Just take it, everything. We have to take it, just write it down. Once the patient is over with the symptoms, then your analysis part start, and then you go from the common man to the doctor's position. And then in a doctor position, our analytical mind, reason gifted mind, start analyzing the symptoms accordingly what patient says. For that we need proper investigative case taking. So that is very important. So listen to the patient like a common man and not as a doctor. Then only we can judge the say of the patient carefully. Most important is patient's story in his own language, modalities as applied to each of the symptoms in the story, the cause. The modalities are very important thing as far as the acute case taking is concerned. The modalities, the change of weather, taking cold, emotions, uh, even getting wet, everything that is very important. Eating outside, lack of sleep, exertion, excessive exercise, everything that comes in the modalities, even the causative and modalities, more than sitting, worse than lying, better by eating, worse by eating, everything. Whatever the patient says in his own language, write it down. Cause, as we have already discussed, prodrome, onset, duration, and progress, what we usually see in the case taking, we learn pace of the disease and the sequence, the character, location of the disease, extension and radiation, the pain. For example, we usually see in spigelia how the pain radiates. So if the patient is saying all these things, these are the very indicative things towards the remedy. Then any concomitant symptoms which we observe during the case taking, aggravations and amelioration to the general aspect, aggravations and amelioration in the particular aspect, these all things which are very, very important as far as acute case taking is concerned. Then comes its time, periodicity, seasons, and moon phases. But this is all given by Dr. Boger. This is very important aspect, that time, periodicity, seasons, moon phases, temperature and weather changes. What we say as patient is chilly or the patient is hot. The patient is aggravated by cold weather or patient is aggravated by heat, or he cannot tolerate any of the weather. Rest or motions, position, that is standing, sitting, lying, is aggravating or giving problem. Then any external stimulus like touch, hard or light, pressure, rubbing, etc. gives problem. Then we have to see that eating, thirst, sleep, these are all things which we consider during the case taking. I usually consider all these things in the case taking. And in females, we see if anything is associated with the menses. Some symptoms are usually seen before menses, some are seen during menses, some are seen after menses, or some are seen when the menses are not there. Because of the suppressed menses, we see some symptoms. So all these things to be taken into consideration. These are very important aspect in acute case taking. Then the discharges, the sweat, then the coryza, bleeding, diarrhea, vomiting, urine, emissions, leukorrhea. See, all these are the discharges of the body. So we have to see the character of that discharges, which which gives us the understanding of particular group of remedies also, which are some kind of remedies which are having these kind of discharges. Then we can immediately prescribe on this if the symptom is very, very prominent. So the discharges of patient has given very important mark. Now, what Dr. Boger says, this it is a central disturbance which is to be treated. Every remedy produces its own central disturbance in the human being, that is altered state, and that is to be treated in this. So we have to see all these acute state, and this is like hunting a treasure. Clues given by the patient has important value. Striking symptoms should be considered first, and it is a language of central disturbance. Okay, so now this is what I do in the acute case taking. I'll tell you one few cases of COVID in which how I came to the remedy. This is, see, in this pandemic, uh, we were there in the clinic, but we were seeing all other cases other than COVID in the clinic since the epidemic had started. But COVID people, those who are affected with COVID, they could not came to the clinic because of the quarantine phase. So once they got fever, they used to call me, or we used to do video call, and then we used to prescribe on the basis of the totality of symptoms. So I will tell you one case of a person who was having fever since say around 6 to 7 days. Then first what he did, he took the some home remedies with the fever, and he was not better with that home remedies. So he took some uh, allopathic medicines from the nearby doctor, and that was also not the case was not subsiding. Then he started coughing. After 3 4 days he started coughing, and once he started coughing, then there was a panic situation in the house. Considering the current pandemic situation, everybody said that this is something different. So he went to the laboratory test, got the reports done, and as expected, there was changes in the lungs, which was represented in the form of opacities, in the form of pneumonia, or in the form of fibrosis in a partial way. So this was the condition of that person when that person entered uh, with the reports. When the patient called me with the reports, "Okay, these are the reports, and I have got these things. Now what is to be done?" So I will say, okay. So I started taking the acute totality as we have discussed. I asked him how it started. The patient said that it was, and the WBC count was, yes, the WBC count of this patient was 20,000. The body ache, and it started with the body ache first. Fever came first day, then the body ache started, and there was some pain in bones, and the X-ray showed some changes in the lungs. So CT scan was done again to reconfirm it. The CT scan showed the pathology is there in the opacities of lungs, and which what we say as uh, pneumonia and fibrosis. So then I asked to about his general condition. He was very dull. He could not, you know, walk properly. It was a very tremendous weakness because of the cough and cold and the fever, and he was getting continuous cough, and the discharge was there, which was very thick, and there was a wheezing with cough, with large amount of discharge, which was coming in mouth, and he has to spit it out. But his wife said that whenever he spits the cough discharge in the basin, the whole basin turns into very offensive odor, that nobody can go into the bathroom then. If he spits his cough in the bathroom, then nobody can enter in the bathroom for some time, at least. So much so is the offensive odor of that discharge. This was a characteristic symptom of this patient, that I could write it down because of this offensiveness of discharge. This There was some dizziness was present in the patient. He could not walk properly because of the dizziness. There was a chest pain while coughing and while talking, and while walking also he was getting some chest pain, some breathlessness and wheezing, and this was a presenting symptom. The another thing I asked about the thirst of the person. The patient was very much thirsty, but he could not take water very frequently because he was having sips, the thirst for sips of water, small quantity of water he was able to take. But the strange symptom was, after taking the small quantity of water, immediately there was vomiting of the this thing, vomiting of water immediately after eating, after drinking, and which was thrown out. Then uh, the person was taking covers, and he was not allowing other people to switch on the fan. So obviously the sensitivity towards cold weather and cold chilliness was marked. So this patient was chilly. So this was the acute totality we have taken on the phone. And the another thing which I asked about the general aspect, what made you feel uneasy, any other reason? And the patient said that he wanted to invest something, and about somewhere about in a real estate, in a new flat, in a new uh, building, new construction. And as present scenario, the cost of that flat was very high. And this fellow was saying to me that I am ready to pay in crores about whatever the price of the flat. I am going to pay. I'm making all these arrangements of the flat. And I have that money, don't worry. I'm going to do it. A little bit stressed up, is tension is there, but it's okay, fine, I'm going to do that. So this was a presentation, and he was talking so fast that even I was requesting him, don't speak so fast. I cannot understand what you're speaking. So I always, that time I told him to speak slowly, but the pace of the person was very fast. He was speaking, this. So that way he was talking. And so then uh, he was talking about all these money matters that I am spending in crores. And then I asked the reality. I confirmed the reality, reconfirm it with his wife, asking that are you going to invest in that flat, and does anything that is things to worry in this case. Then the wife said, doctor, we don't have money to invest in it. He has a small amount of money in his hand, and he is talking about investing crores of rupees in the flat. So that is what he feels, that he has got a lot of money in his hand. And I asked her that whether this situation was there before. Then she said no. 8 days back, he was quite uh, tense about how to manage the things, how to manage the money and amount, as his dream is to go to the bigger flat, and he was just investing it, thinking of investing it. But after getting fever, he is in a state that yes, I am going to invest it, and I'm doing this, I'm taking money, I'm paying crores of rupees, and all these things he was talking. So this was an acute change in his state of disposition. That was very, very important aspect. So then I said, okay, fine. So all this totality was taken into consideration. And now the time comes for the, what you can say, for the prescription. So I'll tell you the uh, prescription I have written. Just a second. I'll just show you the report of that person uh, before he started the homeopathic remedy. What was a change, how the change has occurred within 8 days after the homeopathic remedy was prescribed. I'll just show you the I'll just show you the first report with the patient, where the patient was having obesities. Just show you. I'll just show you the report. See, this is what uh, the report shows. The CT scan reveals, the CT study reveals CT study reveals small patchy consolidation in right base associated with few fibrotic opacities in both lungs and bilateral pleural effusion as described above. The pleural effusion was also there. The appearance is highly suggestive of infective process. Pleural fluid aspiration analysis is highly recommended for further evaluation. So this was the first report for which he was worried about and he considered to take our medicine. And then after the remedy, what I have given, see how the changes came in the within 8 days. I'll just show you the next report. Just a second. See, the next report we will bony thoracic cage reveals no gross abnormality, no evidence of active lung parenchymal lesion seen on either side of the chest. Most claustrophrenic angles are clear. Cardiomegaly noted. No evidence of enlarged hilar gland seen. Tones on diaphragms are clear. Cardiomegaly, and there is no other pathological changes seen in this patient. This person is still under my treatment for some another cases, another cause, but in acute condition, these changes are seen in just 8 days. So these are the things which we have to see in the case. So after that, I will tell you, I will show you this person's what he says after the remedy.
हेलो सर, हो गया आपका?
नहीं चालू है.
ओके ओके.
So this is what the patient has said about his present condition.
So we were not able to hear anything.
Acha,
Yeah.
the video was not clear?
No.
Oh, okay. I'll just play it again.
Yes, sir.
Should
Yes, sir.
yeah.
So still there's no video being played.
Video is not being played.
No, sir.
Oh, just a second. I'll play it again. Oh. Now you can see that
Yes.
person.
Yes, we can see the person now.
Okay, now just a second. I'll play it.
Volume, sir, volume.
Just a second. Just a second. Now you can see that person, no?
Yes, but volume is on there, sir.
Yeah. I'll do something.
Yes,
Just a
yes.
second.
So it is not audible.
Just a second. I'll just do something.
Yes.
ऐकू का येत नाहीये. एक मिनिट. Just a second. I'll just check.
Yes, sir.
Green. Now you can see that person.
No, sir.
Okay.
Sir, no problem. I think it's some technical issue. You can just give us a gist of it. No problem. Just let us know.
Yeah. I'll just try in 1 second. If it is not working, then we'll just stop.
Yeah, just give it.
Yeah. Now you can see him.
Yeah, we can see him.
Now
We can see, but volume. No, sir, it is not audible. It is not at all audible.
now you can hear.
No, sir, no.
Okay. I'll just.
So yeah, just give us a gist, sir.
Yeah. It's some technical problem. Must be.
Yes, sir, no problem.
Yeah. See, what he is saying that he came to us for some suffocative problem was there, as I have discussed already. That then he said he is telling about the follow-up, how he is feeling better after that. And this is a fellow whose chest X-ray we have seen, where there was some bilateral changes of fibrosis with pneumonatic changes in it. And after 8 days only, we have done the second report, which showed complete resolution of the problem area. So this is what he is, how he is satisfied with the homeopathic remedies, homeopathic treatment that he was narrating in his follow-up. So I have requested this fellow to send me this video from his home, how he felt after taking homeopathic remedy. So he had sent this video to me. So because my clinic is at Kandivali and this fellow stays at Dadar. So he has sent me this video on WhatsApp. So that is what I'm sharing. Maybe probably some technical issue that you cannot hear that. Okay, so I will come to the remedy part. Can you hear me now?
Yes, sir, we can hear you.
Yeah,
Yes,
yeah,
sir.
yeah. So now the remedy part. Now the remedy part of it. The remedy part is what is the totality about is the fever, which is with high WBC count. That itself suggests there was a septic condition in the chest, the acute, the pain in the bones, body ache, the effusion, the pus cell, which itself suggests the septicemia. Discharges are offensively foul, and the person cannot stand in front of that person when he was expectorating something. The bathroom was full of offensive smell. He is very thirsty, but that is getting vomiting, chilly patient, and the state of mind has changed. That is the loquacity very fast. First thing what we have observed. And the second thing is that he was having a delusion or hallucination or some false concept that he is very wealthy. He was talking about crores of rupees of investment, in actuality which he was not having that. And 8 days prior to the infection he was not having all these things in his mind, but the opposite thing was there. He was very much concerned about the payment and what is to be done for the future. And in this acute condition he was talking something different, saying that I have a lot of money in my hand, I have uh, everything I will spend and everything. So this was talking about the money and wealth, with wheezing, with the offensiveness, with cough and chest pain aggravated by talking and coughing, with the sphere of action of respiratory system as well. I have prescribed pyrogen. I have prescribed the remedy called pyrogen in 200 potency, 2 doses. I have given 1 dose stat. I have told him to take that dose first. We observed it, and it was yes, yes. I'll do this. Give me 10 minutes. So this is all I have given a pyrogen for this case. And if this pyrogen case, after even in 2 doses of pyrogen, the patient pathological condition got reversed and the patient was all right. Another hello.
Yes, sir. Yes, sir.
Yeah, the second case, I'll just give the small gist of a second case, which came for the again for the COVID pneumonia, having the changes in the lungs, and which was successfully treated with us. With the patient came with the complaints of dryness in the throat and very dull, and not but even with the dullness, the patient was not sleepy. The patient was, just lying on the bed. Even a slightest disturbance causing slightest change was getting disturbed, and he was worried about the pneumonia. He was not worried about the COVID things. He was not worried about, when asked, he was not worried about COVID. He was not worried about the fever. He was not worried about the pneumonia. He was worried about the expenditure which will be going to take if he is hospitalized, and what about his salary which is going to get, and what about his work which was pending. So on this basis of lying listless but not sleepy, dryness, lying motionless, business thoughts of work and money, with another symptom was hardness of stool, I have prescribed Bryonia alba 1 m. Bry 1M because his mental state of about this was very much prominent. So I have given a dose of Bryonia 1M, which helped him to the patient to get all right in 4 days. The fever subsided in 2 to 3 days, and the pneumonia patches also went away in just 2 to 3 days after the fever, which went away. So these are the acute prescription which was given to the second patient of COVID patient, which was Bryonia alba. First was given was Pyrogen, and third patient, which was aged person, was there with age of 75-year-old. He came, he was on the phone for the fever since last 8 days, and he was concern about the situation that if I get fever, then who will look after me? Who will take care of me? Who if I'm getting COVID, then nobody will look at me. Nobody will listen to me. This was his state in acute things. He was not bothered about about the pneumonia or what will be, but he was bothered about these things. The physical generals where he was very hot. He was allowing everything to put on AC. He wanted fan with no covering. Thirst was very less with respect to whatever he was drinking previously. There was continuous lacrimation, watering eyes, water coming from eyes, and it's very dull. And then at the same time, he was just asking everybody to come and sit near him. But as a COVID patient, nobody was ready to sit near him. So this was bothering him that nobody is taking care of me, nobody is sitting near me. This was the acute condition. On this basis of acute totality, with the COVID pneumonia case, I have prescribed Pulsatilla 1M to this patient. Again, with the great amount of anxiety, made me prescribe a higher potency. Usually, in acute conditions where the higher stimulus is needed, so I usually prescribe a higher potency in acute conditions, which I have seen very good results in that in a single dose. So I have given Pulsatilla 1M to this patient, which made the patient all right in just 3 to 4 days, with the changes in pneumonia or the changes in the lungs also get reversed in 4 to 5 days, which we have done afterwards. The X-ray was done afterwards. So all these reports usually I usually share to all people on my Facebook page. If you want to see all these things, you can go to the Facebook page, and all these reports are already posted. Today, this topic is so big, but I have only 1.5 hours to speak on it. So this is a very less time to speak on this topic. But still, sometimes we will meet some days to speak or detail whole day on this topic. With these small 3 cases, I sum up with this session. If anything is there, you can please ask Bhosle madam about this. She will convey the questions to me. I will forward the answer to the college. Then the people will get the answer. Or those who have my mobile number, they can directly ask me. Thank you so much for calling me. Thank you, Varsha madam. Thank you, Page madam. Thank you, Bhosle madam, for inviting me for the seminar. Thank you so much.
So we have a question answer session, just 2 minutes.
Yes.
Thank you, sir. I appreciate sir's clarity in explaining us how to effectively gather the totality of characteristic symptoms via observations, listening to the patient, and various other factors. I'm thankful to both our speakers today who have helped us achieve our aim set for the webinar. I'm sure henceforth the essence of incorporating homeopathic principle in the management of acute diseases shall never be missed by us. I'm sure there may be certain doubts in the minds of our viewers, but which may have got cleared. But in case there exist some more doubts, we shall be clarifying it. Due to short of time, we shall not be able to take many questions and answers, but we may just take one question for sir and one question for ma'am, Seya ma'am. So I pass on the baton to Dr. Sampada Ravle, Assistant Professor, Department of Organ at Dr. G.D. Paul Foundation, YMT Homeopathic Medical College, to conduct the question and answer session.
Good afternoon all. So there is a first questions to Dr. Sneha ma'am. On what basis potencies were selected in epidemic from low to high? Bhosle ma'am.
Yeah. Yeah, potency selection in epidemics. Am I audible?
Yes, yes, Sneha, you're
Yeah.
audible.
Yeah. Potency selection in epidemics is like any other case, an approach, homeopathic approach of the principles of posology regarding law of minimum. So, depending on the case, that is the type of symptoms, the method or the principles or the rules are the same. That is the seat of disease, the type of pathology, and the type of symptoms. If there are more characteristics, you go with higher potency and repetition will be less. And if there are less characteristics, we go with low potency and stimulate the case more with higher stimulation. The principles are the same. That depends on individual case. As of now, Ayush, so far as this COVID is concerned, has given the genus epidemicus arsenic with the potency 30. They have advised as a preventive, also prophylactic, and also as a therapeutic measure. And repetition will be decided by the case.
Thank you. There is a one question to Mandas sir. Do you have any experience of using no source in this pandemic?
Yes, yes, I do have. I have already shown one case of pyrogen now,
Okay.
which is first case of pyrogen, which I have already discussed with you. I have also prescribed. See, that is why I've told you we have very running short of time in this case. I have lot of cases to discuss about COVID-19. I have prescribed tuberculinum. I have prescribed syphilinum. I have prescribed medorinum in cases, and where nosodes. See, the only thing is when the well-selected remedy fails, nosode is to be concerned. This sentence I usually have never understood in my career, even in my academic life also. When the all selected remedy fails, nosode comes. I feel whatever things which are matching in the case, then we have to select the nosode. Then well-selected remedy fails, मुझे अभी तक समझा नहीं है क्या है वो. But वो जो remedy, whatever we see on the symptom similarity, that we come, if the nosode comes, I do prescribe nosode. That is that simple. No magajmani. But I have prescribed nosodes with like, so this is syphilinum, medorinum, tuberculinum, and this pyrogen. I have just shown it to you.
Okay. Thank you, sir.
Okay, thank you.
Thank you, Dr. Sampada. And now I invite the eminent chairman of today's webinar, Dr. Page ma'am, for her valuable insights. Madam has been the principal of this institute since the last 28 years. She is the HOD, Professor, PG, and PhD guide in the Department of Organon and our college. She has a vast clinical experience of over 40 years. Welcoming Dr. Page ma'am for the chairman's address.
Good morning. Hello. Can you hear me?
Yes, ma'am, yes.
Okay. Good afternoon, one and all. Dr. Sneha, I would like to speak about Dr. Bhosle's approach and the philosophical views as an academician, whatever she has given us with different books referring and literatures. As everyone knows, she's an excellent teacher and a practitioner. She had given the views about, hello, she has given the views from different books and literatures, and also since 1347 till 2020 she had given us so many approaches about all epidemic cure and diseases, whatever, from cowpox, from yellow fever, Spanish fever, polio, dengue, SARS, chikungunya, tuberculosis, and right now HIV, and to the literature of COVID also. With this, she's also explained us regarding the nosodes and how, like Dr. Patkar is saying, nosodes as a medicine. She has given how it was prescribed during Hahnemanian era and Boning Hussein's time. And also she has given with the philosophical concept of symptomatology, how to go with the posological aspects, and lesser writings also she has given the approach directly very thing. And for research, she had given how the CCRH research and Ayush research are going on, and what we want to have in our, what are the challenges right now we are facing regarding COVID, as government of Ayush has thought of giving and given us the possibility as arsenic album 30 potency as a immunity or prophylactic treatment which is given officially by government. But we have a second speaker with us, a eminent Dr. Mandar Patka, who is given us a typically method of homeopathic case taking with the acute case taking method in detail, being as a, he's also being a teacher for the students and in the clinic what he is observing with the patients, and he had treated, as he said, cases which with the time management we can see only 3 cases over here, but you can surely go to his Facebook, and he has given with the technical issues we can't see the cases over here. He has given the essential points for the symptoms, imaginations, Bogart's performa and performances about case taking regarding time, periodicity, moon phase, etc. He had given explained it in detail, and we expect him to be there more with us regarding the state of patient and how to when and how to give the approaches about the remedies in detail about the students. I'm very much thankful for the listeners, and being a national webinar, we should continue this type of phase of organon next time onwards also. Very good approach with the staff members, students and listeners. Thank you so much for joining us.
Thank you, ma'am. Thank you for your helpful inputs. To conclude this webinar, I now welcome Dr. Yokesh Mandle, Assistant Professor in the Department of Organ in our institute, for the vote of thanks.
Thank you, Shama ma'am. Good afternoon, one and all. I take an opportunity to express my gratitude to all the participants who had attended this webinar today. The first and foremost, I would like to express my gratitude to our esteemed chairman, Dr. G.D. Paul sir, who is a constant source of inspiration and support and guidance for all of us. Second, I express my sincere thanks to our Dean and HOD of Organ Department, Dr. Pramodini Page, for giving us a wonderful platform on in the form of this national webinar. I also extend my thanks to our Vice Principal and Dean Faculty of Homeopathy of MEHS, Nashik, Dr. D.G. Bagal sir, for his unconditional constant support for the national webinar. And I also express my thanks to our today's first speaker, Dr. Sneha Bhosle ma'am, who elaborated the philosophical perspective in homeopathic management of epidemics. I also extend my thanks to our second speaker, Dr. Mandar Patkar sir, for sharing his valuable hints in understanding totality of symptoms in homeopathic management in COVID-19 cases. This was indeed a very informative session for all of us. I express my thanks to Department of Organ and Staff, Dr. Varsha ma'am, who hosted this webinar event, and Dr. Sampada Ravle, who conducted the question and answer series smoothly. I also express my thanks to Dr. Sunil Karande for his technical support and arrangement. Also express my thanks to IT department, Dr. Prashant Godse and his team for the technical support and arrangement. Also express my thanks for teaching and non-teaching staff. And last but not least, our audience and viewers for attentively attending this session. With this, we are ending this session. Thank you all. Thank you very much.